Welcome back to the third hour of our program, The Threat to Medicare Revealed. We have had pieces of this conversation over the years. Let's check in with Alex Lawson, our old buddy and occasional fill-in host for me on this show. He's the executive director of Social Security Works. The website socialsecurityworks.org and strengthensocialsecurity.org. And on Twitter, it's SSWorks or ALaw202. As in Alex Lawson. Alex, welcome back to the program. Give us an update on where first of all, I'm curious, whatever happened with Trump's efforts to basically destroy Medicare by putting an anti-Medicare guy in charge of it, essentially. And where is Medicare at right now? And then going forward, what are the challenges to Medicare?
Thom, thanks for having me. Yeah, it's a complicated answer because what happened is from Trump to now, the industry forces haven't let up at all, and unfortunately continue to just chip away at traditional Medicare. And there have been some places where we might have shut down some threats, but new threats are opened up by industry. They just won't stop coming to destroy our Medicare. And it's super insidious, as you are one of the few who points out. They're not going after it to just destroy Medicare. What they are doing is they're taking it over from the inside by privatizing Medicare, either through the back door with these direct contracting entities that are renamed REACH entities, and also just through the Medicare Advantage program. And the Biden administration just announced today an 8.5% increase for next year to these Medicare Advantage plans, where these private insurers are right now record profits. So this is just taxpayer money going directly into the profits of these huge private insurance companies. And as you know, Thom, they only make their money in one way, denying care. And every time we look into it, if there's an IG report looking into it, what do they find? Wrongful denials of care. Every time they look into it, MedPAC, which is the institution that looks over the accounting of them, what do they find just recently? We're overpaying Medicare. It is Medicare Advantage. It is bankrupting traditional Medicare. So this program continues unabated. And unfortunately, Thom, I'd say it's accelerating its destruction of traditional Medicare from the inside.
So tell me about this reinvention of direct contracting entities, the so-called DCEs. I was going off on these things 6 months or a year ago when I first learned about it, but now they've figured out that people know about them, and so they're changing the name, or is this a whole brand new program? What's the deal?
No, they got scared. I mean, Thom, it's a classic one, unfortunately. What I say, this was a program that was set up by Kushner and his criminal cabal under the Trump administration. But when it was handed off to the Biden administration, we were out front calling for an end to it. And I first got the warning signs that this was going to be an accepted form of corruption that we would be fighting for the long term, like Medicare Advantage. They just paused one part of the program, and they tried to get us to accept that. And we are, we being the grassroots movement against Medicare privatization, we didn't accept that. And we said, no, you have to end this direct contracting approach, which is nothing more than backdoor Medicare privatization. It's just moving people into a private system without them even saying that's okay. And what the administration came back with, and they wanted us to be okay with it. They said, oh, well, we're going to transform it into this new program, and it's got a new name. It's called REACH now. And unfortunately for them, we know policy, and we looked at it and we're saying this is the same thing. You can't allow private equity insurance middleman into the system and anything other than what they have been doing for over a decade now in Medicare Advantage. When you put someone in between the provider and the patient, what they do is wrongfully deny care. So it doesn't matter what name it's under, it's all one attack. And it's continuing under the Biden administration. Now, do I think it rises to the level of the White House? I doubt it right now. I think it's sitting lower in the bureaucracy. It's under an agency called CMMI, which is under CMS, which is under HHS. And sort of the big thing in a bureaucracy is there's all these levels where decisions can be made. And industry is really astute at targeting these sort of middle bottom levels and taking over that part of it. And it often doesn't make its way all the way up to the White House. But unfortunately for the administration, this is not a fight that people are going to just be okay with. You know, they're not going to lay off on this. This is Medicare privatization, Tom. This is the same thing that you and I have been talking about for literally years here.
Yeah,
so
for decades.
It's just another wrinkle in this fight of industry and Wall Street seeing a public program and looking at it as a potential place to just extract money by hurting people.
We're talking with Alex Lawson, the executive director of SocialSecurityWorks.org. Alex, how, just for people who might have just tuned in the last 6 months or so, you know, it's been a while since I've done a good in-depth rant about Medicare and Medicare Advantage. And Medicare Advantage is on TV, you know, every single day, you know, begging, hey, there's new Medicare Part C Advantage or Medicare Part C. They're not even calling it Medicare Advantage anymore.
I know.
People are realizing the Medicare Advantage is a scam, so now they're calling it Medicare Part C. You know, this in a big way got transformed and emerged during George W. Bush's administration, and I think it was 2003 when he tried to privatize Social Security. That didn't work out all that well. He said he was going to use his political capital from the Iraq War to privatize Social Security. But he did succeed in creating this privatization program for Medicare, Medicare Advantage. And now it's about half of all people who think they're on Medicare are actually on a private for-profit plan. They're not all for-profit, but the vast majority of them are on one of these private for-profit plans. What's the downside of that? What happens to people when they get on Medicare Advantage that they probably aren't being told about when they call that toll-free number on TV?
There's so many places to go at that. The fact that they're on TV all the time recruiting people and only selling, you know, what they see as the positives of it, and they're not actually laying out the true costs. And most people, the vast majority of people, they don't know the difference between Medicare, Medicare Advantage, Part C. It's quite complicated, as you know. And so people think it's Medicare. But the truth is, it's actually just a private insurance company. United Health, you know, made $24 billion last year and most in profits. And most of that money is coming now from contracting with the government. It's from Medicare Advantage and some Medicaid services. So this is the cash cow for the industry. And what does it mean? It means that when you're healthy, everything looks great. This is just like in the private insurance market before Medicare age, right? Most people feel okay about their health insurance right up until they need it, Tom. And that's the whole game. They know that 90% of people at any one time don't actually need their health insurance. It's only 10% of the people who are engaged in it. And when people need their health care, that's when they find out that the profit model of corporate insurance is to deny care. So when you need it, that's when you don't get it. And that's the exact opposite of traditional Medicare. Traditional Medicare is when you need a service, you get that service.
Right.
So the difficulty is the oldest, the sickest, those who are most vulnerable in Medicare Advantage will find themselves denied the care that they need.
Right. So, yeah, I mean, I'm on regular Medicare. I've went through surgery. I've, go to the doctor, all these kinds of things. And I don't have to pre-approve anything. Nothing has to be run by my insurance company. You just show up and you get the services. You check into the hospital. It's all paid for. It's like magic. But I understand if I had signed up for a Medicare Advantage plan, pretty much everything I do would have to be run by the insurance company first. Is that right?
Correct. The same way that most people have, experienced healthcare for their lives before Medicare, which is also part of the trick that these insurers are playing. When they looked into it, when the Inspector General looked into these wrongful denials, Tom, they found that over 90% of people who were wrongfully denied care did not submit, did not know they could submit, and therefore did not submit a complaint saying, hey, I was wrongfully denied care, which they would have been reversed, but they didn't know that that was a thing. So they were just denied care that they needed and thought, oh, that's
so they just paid the $6,000 bill or whatever it is.
Exactly. Or went without care. This is also a big problem. So it's a really insidious system, Tom, but it is also complicated on purpose because at its root, it's really simple. They can only make money by denying care. Right. So if you are covered, quote unquote, by them, expect to be denied exactly at the moment when you need it.
It's incredible. Alex, we just have 45 seconds to a hard break. Tell me, what can people do about this? Is it lobbying? It's Javier Becerra is the HHS secretary, isn't he? If my memory serves me right.
Yes, and we have a lot of organizing going on right now. We have Senator Warren and we have Pramila Jayapal in the House. We have a lot of champions who are focused on this. And Secretary Becerra has said that they need to stop these overpayments to Medicare Advantage. So we have a lot to work with. Even President Biden put a line in his budget about it. So we have a lot to work with, but we need to increase the volume coming from people. And so I think if you go to socialsecurityworks.org, and you connect with us or whatever sort of organizing you do, make this something that you focus on. Make protecting traditional Medicare a focus of your organizing because, as you said, it's close to the tipping point of more than half of the system being private.
Which is going to be hell on wheels if we ever try to do Medicare for all,
exactly.
which I think is planned, is part 2 of their plan. Alex Lawson, the Executive Director, socialsecurityworks.org. Thank you, Alex.
Thanks, Tom.